All right, ladies and gentlemen, thank you for joining us for another episode of the Skirmish Line. Today, we're joined by myself and Travis Yates and a couple of very great individuals from the medical field, and I'll let them introduce themselves and tell a little bit about themselves. Leanne, would you like to go first?
Sure. Thank you so much for having me today. My name is Leanne Stephens. I'm the Marketing and Communications Director at the Tulsa Health Department, also the Public Information Officer. I've been with the department about 8 years now and have worked on a number of public health responses and crisis emergency risk communication.
Fantastic. And your partner today, can you introduce yourself?
Yes, I'm Alesha Elkin. I'm the Manager of Emergency Preparedness and Response at the Tulsa Health Department. We are a CDC-funded program to prepare and respond to public health emergencies. I've been with the department for 25 years, and 17 of those years have been under the Public Health Emergency Preparedness and Response program.
Outstanding. Is there anything that you guys would like to lead off with before we get into questions?
You know, I think that what's important for people to understand is that the Tulsa Health Department is the agency tasked with protecting the health of the Tulsa County residents from a multitude of infectious diseases. And so while we are certainly in the spotlight during this time for the COVID-19 response, this is something that we routinely operate under our infectious disease prevention protocols and emergency planning, preparedness, and response protocols. So I hope that your listeners know that this is not something, while this novel coronavirus is certainly new to us, the business of protecting the health of Tulsa County residents is what we do every day.
Fantastic. So when did this virus really come around and hit the mainstream? When did we notice this internationally?
The novel coronavirus really originated in China, in Wuhan, Hubei province, in December of 2019. In the United States, travelers started to return from affected areas, and the Tulsa Health Department has been monitoring returning travelers from China since January. So this has definitely been something that's on our radar. Our epidemiologists have been monitoring all infectious diseases worldwide very closely because we know that the nature of the way that people travel, we know that things that are occurring across the globe can impact our local region at some point. And so this is something that the epidemiologists have been monitoring for some time now. And we just recently in January, started doing active traveler monitoring for returning travelers from China. That later expanded to Iran. And currently, our epidemiologists are focused on doing the contact tracing and investigation for anyone who tests positive for COVID-19.
And the way you do that is a lot like a criminal investigation for police officers. We're familiar with that. You start with one person and you work that tree backwards, correct?
Absolutely. You know, we sometimes refer to them as the disease detectives. And so they are speaking to an individual, really retracing their steps. They go through a lengthy interview process with that individual to identify any potential risks of exposure. So that is truly retracing an individual's steps, asking places they visited, people they may have come into close personal contact to, and depending on the disease, identifying those risks for exposure and then contacting those people or contacting those businesses or settings that may be at risk of exposure.
And I can't imagine how difficult that would be with a virus like this. I'm understanding that with COVID-19, it can be contagious for days, even a week before symptoms are displayed. So someone can be transmitting the virus before they even know they have it.
There's a lot that we still have to learn about the novel coronavirus. The main way that it is thought to spread primarily is when people are the most symptomatic, so when they are the sickest, and through close personal contact for prolonged periods of time. So when our disease investigators are looking at a positive case, they are identifying those potential risks of exposure using a more narrow criteria. So, for example, something like measles, we know that the spread through droplets that that can stay in the air for up to 2 hours after an individual leaves a place. So for something like measles, mass notification of everywhere that individual went is critical because we know that that virus is in the air after that person has left. With the novel coronavirus, our epidemiologists are really focusing their investigation on those individuals who had close, prolonged contact. So an instance or an environment where they may have been coughed on, things of that nature.
Okay. Is there basic things maybe that we haven't heard in the media beyond social distancing and washing our hands that people can do to lessen their chances of contracting this?
I think you said it best, washing your hands and avoid touching your face. Also staying home, that social distancing, putting physical distance between you and other people to limit your exposure. Now, we know that our first responders, that is not an option, and we know that our first responders are in the front lines of this response, and we are so grateful, so extremely grateful to law enforcement professionals, all first responders, for continuing the work that they do, because those are the essential jobs that need to occur to keep our communities safe.
Travis, do you have any questions that you would like to throw in?
You know, this isn't the first pandemic we're familiar with, and I think the question on a lot of people's minds, I know it was my mind early on into this process, is I think we had H1N1 close to a decade ago. We had, thousands of Americans die from that, and we didn't see the same type of response. And I would like you to just kind of line out for our audience kind of the difference between this pandemic and the earlier pandemics. I think SARS may have been another one, and why we are responding the way we are, and it's so drastically different than those pandemics.
Alesha, do you want to speak to that?
Yes, please. That would be great. I've been asked this question recently, and I had to do a little bit of thinking to come up with the answer because it seems like it would be a very similar situation. It was a novel disease that jumped from an animal species to a human, and I think the difference is influenza is something that we are familiar with on a seasonal basis. We are all encouraged to get our flu shots each year. And I think the biggest concern for H1N1 was the fact that it was a new strain of flu and it wasn't a completely new disease that people hadn't heard of before. Coronaviruses, while this particular one is a novel virus, they have been around, but they're not on the forefront of every season. Everybody knows a common cold, but they may not know it as a coronavirus. This particular coronavirus is concerning because of just how quickly it spread. There is no human immunity to it because it's so new into our species that the unknowns outweigh the knowns, and I think that's what's causing people to react the way they are, buying excess amounts of products just for fear that they won't be able to get out again to get more.
And just like the flu, I keep hearing about the second wave. There's a lot of second waves in these pandemics. I know in 1918, the second wave, if I believe right, may have killed more than the first wave. I may be wrong about that. Are we expecting that with this one? I think everyone keeps looking at the calendar, and they were thinking 15 days. Now they're thinking 21 days. And then I've heard June or July. I know President Trump said Easter. But I think what our audience needs to know is that doesn't mean it just gets eliminated. Kind of tell us about some of the planning that your leadership is doing there at your organization, with that in mind, that this does not just disappear in 3 weeks, that this is going to continue throughout the year.
Sure. I think that that's a great point to make. And when we talk about all of these measures that are being put into place, really the intention of doing this is to flatten the curve or slow the spread. That does not mean reduce the spread entirely. What we are trying to do is avoid that spike on the medical system. And so doing these measures, and we're reluctant to put a timeline on that because, like you said, we just don't know. There's still a lot there's still a lot to be learned about this novel coronavirus, but all of these measures, in the absence of the pharmaceutical therapies, are done solely to reduce the spread of the disease in order to reduce the strain on the healthcare system.
I've got a question, just changing just a little bit here. The governor had talked today, and of course, we're a nationwide podcast, but a lot of our information right now during this crisis is coming out of Oklahoma because that's where Travis and I are based out of. But I heard our governor in Oklahoma talk about closing non-essential businesses. What would be an example of essential businesses besides emergency services?
So some of those essential business include healthcare systems, public health, grocery stores, pharmacies, industrial manufacturers. There is a list that is available on our website, and I know that this is a podcast, and so I can't tell you to click the link, but there are lists of essential businesses, and it's my understanding that the governor's executive order will provide a little more clarification on that.
Okay. How are you tracking outside the state of Oklahoma? Are the measures that we are taking as a nation, is it starting to flatten the curve? Are we seeing the positive effects of what people have been doing with social distancing? Does it look like it's making a difference?
I think it's too soon to say.
Okay.
That's not a great answer. You guys have another answer for that?
Alesha?
I honestly, that is the only way for us to know how well the measures we put in place today work, are to see if the numbers start going down in the next 7 to 14 days. I wish we had a magic 8 ball that could tell us what that's going to look like, but it's truly going to be seeing the response in the community and whether or not the number of instances decline.
Well, I will say for both of you, my deepest gratitude for the work you're doing. Of course, this is, like you said, nothing new to you. Your teams do this year round, and 365 days a year, every year, and you're prepared for this. But I think, this is an education that many of us are all getting. And, the only thing that I can kind of draw to as far as the public's reaction to this, as far as the appreciation, is 9/11. And I think we saw a deep appreciation for first responders and the medical field and all of those civil servants after 9/11. Of course, that has a shelf life, of course. But I think the difference between this and 9/11 is most of us in America after 9/11, that was a tragedy and that was horrible. But we didn't think that was going to impact us. After a week or two, we were not back to normal, but we were back to work and we were going about our lives. And that was New York City. That was far away from most of the country, and you don't think that affects you. This is completely different. This is, this is affecting every American, even if an American stays healthy, it's going to affect every American financially. It's going to affect their job. It's going to affect every single fabric. There's not anyone in this country that doesn't have a story to tell today, and those stories will probably get worse as time goes on. How do you see the resilience of what you do and what this country does as we move forward in this? Do you see a sort of a timeline on that, or what kind of suggestions would you give to everyday Americans moving forward once the quarantines are done, once the orders are done, and once people are getting back to normal? Are there some suggestions you can give them as they move forward?
I think I don't want to make those comparisons, but it's truly unprecedented times, and the measures that we are asking every resident to take are truly unprecedented. We've never asked people to stay home. We've never asked, as a nation, as a state, as a community, we've never asked this of people, at least not in recent history. And I think that people are understandably very scared. People understandably have a lot of questions, a lot of concerns. People's livelihoods are being affected. We understand that with this closure of schools, we understand that there are children who may not have access to meals to eat. And that is a tragedy. We understand that these businesses, some of them that are being asked to close, some of them may not have the resources to reopen. And that is a horrific, horrific tragedy. What we are doing all of this to try to do is to reduce the strain on the medical system, to reduce the number of lives lost. But you're absolutely right. The resilience of this nation is really going to be brought into the spotlight as we as we recover from this pandemic, that recovery period is not yet here. So steps that everyone can take is be a neighbor, check on your friends and family, call or text, check on people, ask what you can do, ask if you can pick up extra supplies for someone who can't leave their home, make a donation. There are numerous charitable organizations that have been established, and open your wallets if you can. Make those donations, purchase gift cards to local businesses, but do everything that you can to help out the community, because this is affecting the community and it's going to be a community response as we move forward.
Do you have any advice for people that are questioning whether or not they've been exposed? They're not showing symptoms. They were around somebody that maybe had a fever or had a cough, but due to the short number or small number of tests that are out there, we're not able to test everybody, and that's okay. But with that being said, do you have any advice for people that most likely will find themselves in that kind of situation?
Our number one recommendation right now is for those people to stay home. Even though they may have mild symptoms, that could be dangerous to someone else who doesn't have the immune system to fight back. And so those individuals that are experiencing mild symptoms, we recommend that they stay home, monitor their health, and contact their medical provider if it worsens.
Do we have any idea how long they're contagious after they stop exhibiting symptoms? So, for example, if you've got a strong immune system, you're a younger person, you come in contact with somebody, a few days later you start running a fever for a day or so. After stopping running that fever, how long until you're safe to not transmit that virus to someone else?
So the recommendations right now from CDC is, first and foremost, is that each individual responds differently to the virus. So how long someone is actively sick varies depending on, person to person. So each decision to release them from isolation is made on a case-by-case basis in consultation with their doctor and infection control practitioners. But the standard is at least 7 days from onset of symptoms and at least 72 hours after your last fever without fever-reducing medication. So minimum of 7 days from first symptom, but if you still had a fever, you have to wait 72 hours after that last fever before you would be considered safe to re-enter the community.
Okay. I'm still just blown away by the resiliency of our country and how willing people are to help. This story about distilleries making hand sanitizer from scratch just absolutely blows me away. It's things like that in a crisis like this really warms the heart and gives you hope. Are there any other stories other than that the two of you have heard that you would like to showcase?
The Tulsa Health Department has received several donations from businesses and industries of personal protective equipment, or PPE. We will be making those donations available to our regional medical response system. And so I think the generosity of businesses to give what they can has just been really appreciated, because we know that the PPE shortages are very real, and we are doing everything that we can to help mitigate that. And the donations that we are receiving, we are then pushing out to our regional medical response system so that they can get it to people who need it.
All right.
We learn from every one of these tragedies that we go through. Every event that goes on, you can go back to the terrorist attacks to just about anything, and law enforcement active shooters, all the things that occur, we seem to always take learning lessons from them and try to improve for anything in the future. Is there anything on either of your minds that maybe we would all do, either as a community or as healthcare providers, or even in the first responder world, that we will do after this to prepare for potentially, you hate to say it, but something else like this down the road, where we are more ready and more prepared? I don't think anybody saw this coming. I don't think there's really anyone to blame, but maybe somebody in China, right? We don't know who that is, but what do you take away from this, and what do you think is when the dust clears and we kind of get back to normal? What kind of preparations would you recommend that our community does so in the unfortunate case this happens again, we could be a little more prepared?
The one thing that I have seen just in the last couple of weeks is the personal preparedness of having enough food and water to get you through we used to recommend, 3 days worth for each person in your household of food and water and medications and dog food and, toys for the children, paper goods. I think that 3 days was a short period of time, and that maybe people would have a little more reserve for those who can afford it and those who have space to store it, that they would have a little more self-sufficiency for a little longer period of time, and maybe that would minimize the rush on supplies in the face of a pandemic.
Yeah, the one thing that I know I thought of is now I know why my great-grandfather saved all his money, right? He went through the Great Depression.
Yep.
He felt the effect of that, and he remembered that his entire life. And I always wondered how this man that didn't have a heck of a lot had more money than me at all times. And and I know the mindset I know in me and my family is there's a reason why they want you to have 6 to 12 months of income in the bank, right? I think very few Americans have that. I think I read a study where 50% of Americans have, no more than $400. If there was an event that's more than $400, they wouldn't be able to afford it. So that's the one thing that sticks in my mind as individuals. But I think you're right. Those preppers that we seem to make fun of throughout the years, they look kind of smart right now.
I think another thing is, as a nation, I think everyone is a lot more germ aware. We've heard numerous people indicate that while they washed their hands, they never really thought about how long 20 seconds actually is. And when public health professionals recommend frequent hand washing every cold and flu season and year round, I think that as a nation, I think as a community, everyone is a lot more conscious of the way that germs spread, how to protect themselves, wiping down those surfaces. So that's something that I hope will continue.
I've got another quick question. Is there anything in history that we can really compare this to? I know we've talked about it being unprecedented, but can we draw any similarities between this and the Spanish flu or any of these other things? I know medical technology has advanced and our society has advanced since then, but the way that virus spread and moved around the world, is there any similarities we can draw?
I think just the emergence of a new disease that hasn't been seen before in the population is the equivalent. But as far as how quickly it moved or how many people lost their lives as a result of it is going to be different because of the things that you said. Our medical system is different. Our medications that are available to us are different, and the technologies have changed. And I think that other than being a disease that had not been seen in the human population before, there are very few similarities that we'll be able to see currently. Maybe in hindsight, there could be some comparisons done after the fact, but right now we don't want to make that comparison because it is a very different time and a very different disease.
I understand. Do y'all have anything else that you would like to say? Travis, do you have any questions in closing?
No, I just really appreciate what each of you are doing. I know you're working nonstop. Please give our appreciation to all of your team and all of the medical providers out there. Thank you so much.
Thank you. Thank you so much for having us.
And I think on my parting words is, we have exercised with our law enforcement partners, at least in Tulsa County, for the last 15 years, trying to ensure we had plans in place for the next anthrax or pandemic influenza. And so I'm just glad that we get to continue these partnerships with our law enforcement agencies. It's unfortunate the circumstances that we're working together, but at the same time, these relationships have been built and have been strong for these years, and it's paying off, I think, in the community and how we're able to keep our citizens safe.
Well, I just want to say thank you to both of you for joining us here on the Skirmish line. We're very humbled and appreciative of the work that you do, and it's truly an honor to be able to speak with you today. Thank you for taking the time out to inform our audience about some of the things that are going on with COVID-19.
Thank you so much. Stay safe.
All right, ladies and
Bye-bye.
gentlemen, thank you for tuning in to another episode of the Skirmish Line. Check back with us for updates. Follow Travis on officer.com and have a great day. Bye-bye.